Hi and welcome. I'm Steve Martirano, and this is the Behavioral Corner. You're invited to hang with us as we discuss the ways we live today, the choices we make, the things we do, and how they affect our health and well-being. So you're on the corner, the Behavioral Corner. Please hang around a while. Behavioral health is a big, broad topic. That issue, like so many other issues in our lives, has been profoundly impacted by the current coronavirus pandemic and the quarantine. There is no aspect of our lives that have not been touched about this. We've been talking to people here on the first couple of Behavioral Corner shows about how their business and their perspectives have been altered by this, and asking them to guess with us in a great deal of uncertainty about what the future may hold. To that end, we welcome Peter Schorr. Peter is the founder and the CEO of Retreat Behavioral Health, and he is, of course, our great good partners in this program. They underwrite the program, Behavioral Corner. Peter Schorr, always a pleasure. How are you? Is everyone safe and secure in your life?
Everyone's good, thank you, Steve. How about yourself?
We're holding up as well as anybody else. We really what we find ourselves doing is when we start to whine or get upset about all the restrictions, you just remember how lucky we are. I mean, we really have been, relatively speaking, lucky. So, Peter, we're launching into the brave new world of podcasting here, and we always value your support and partnership in here. The retreat has always been beautiful about this. They bought right into the idea that while they're paying the freight, this is really about information and education, and we need both of those things in abundance right now. So let's begin with the crisis descends upon us all, and what things occurred immediately and have been occurring within retreat as a result.
Well, a lot of things have changed. I mean, look, the whole world has changed since March, where this has been brought to everyone's attention. This, as you said earlier, the virus. It's called now. It's got a crazy moniker, the virus. But it's changed the way a lot of people do business. Obviously, in our industry, you have to understand that addiction and mental health disorders don't go away because of a virus. Sometimes they're exacerbated because of this. And people suffer a lot of different mental health breakdowns because of being isolated and being quarantined for such a long period of time. And uncertainty brings a lot of anxiety into people's lives. It's anybody, not just people who are suffering from mental illness, but anxiety, it does a lot of things to our psyche and makes us do things sometimes without even thinking about it, how detrimental it is to our safety and to our health. What we've done is, we changed the way we do business, especially on the outpatient side. So the outpatient side, we couldn't have patients coming in daily because we can't monitor who they're around, because as we know now how this is discussed is, it's almost like you got to track history of people before you can even talk to them. So being on an outpatient basis, we don't know where patients have been, an hour before they come to us. So we launched telemedicine, which has been very successful in reaching people. People have found it to be an easy way to get help and get on the right track and stay on the course that was set out for them on the inpatient side. The inpatient side hasn't changed, other than how we do business on the inpatient side and how we screen for new patients coming in, how we treat new patients when they come in, what we've done with the patients that are there to make everything safe. Our first priority has always been the safety of our patients and our staff. We have some amazing staff people, especially essential staff, who they haven't been off from work from this. They've gone to work every single day. They've done what they had to do, and they made sure that our patients get the services that they need. And that, a big kudos. You hear about heroes of nurses and people in the front line, and that's what we have.
Yeah,
we have nurses, we have doctors, we have CAs, we have therapists, we have all these positions, and dietary that our transportation is continuing to pick people up who are sick and need our help. These people did not waver. They came to work. They did their job, putting themselves in harm's way. I mean that's, the uncertainty is we don't know what is. We don't know anything, so it's being that professional and that dedicated to what you do, to put yourself in harm's way, to make sure that people get what they need is inspirational at the least.
Yes.
So, we've done many things to make sure that people are safe. That's our priority.
Well, very early on in the crises, we had your Melissa Callahan. Melissa is your head of nursing and just an absolutely amazingly dedicated and competent healthcare professional. She also is your go-to infectious disease person, and she along with the rest of your staff, really mounted a very aggressive program in the earliest days of the virus. I mean, you had this unique situation. It's easy to see how you would handle the outpatient thing, but in a residential context, you had similar situations that we see turning out very badly in other long-term residencies that you had to lock down. What are some of those early steps that you guys initiated in the residential aspect of this thing to make sure the people that you had under your care were safe?
Again, just what you said about Melissa has done an amazing job. Melissa has guided us on the medical side on what we should do and what we shouldn't do. So, that's been very, very helpful. When it first came to this and learned about this disease, we had to do things on the fly because no one really understood what it was about. So the thing about social distancing and things like that. So what we made a conscious decision to do with patients that are there is have like less people in the cafeteria at one time. We closed down the fitness centers. People come in one to a room for 48 hours. Before they come in, we do a 3-phase assessment by our medical providers, and that includes being on camera so they can see them. So it's not just talking on the phone. So there's a lot of things and a lot of effort made to make sure that people are going to be safe. Not only the people coming in, the people that are there, and the people that work there. So it was a lot of different components, moving components to make this work. And I think we did a really good job.
Yeah.
I'm really proud of the way everyone did it.
Well, yeah, because it alerted to the interested parties that in spite of this, life-changing event, that if you needed help, there were safe places, if they were doing things right, where you could still go get treatment. I'm sure the immediate reaction for a lot of people was, well, I'm going to have to put off my treatment till this thing is over. That's not the case if the facility is ahead of the curve on this one. I tell people lots of times when they have questions about getting into treatment and what to expect, I said, look, one of the things that seems to me to be real important is that whoever you get in front of when you're looking for treatment, whether it's mental health or substance abuse, that first point of contact with them, the intake portion, is really important. You should pay attention to the kind of questions they ask you because that'll give you an idea of how comprehensive and thorough they are. Your intake has changed immediately. When somebody shows up and say they need help, you take temperatures, you do all that stuff, right?
It's much more comprehensive than first of all, people don't just show up. I mean, they call us for either a pickup or someone's going to drop them off. And we do a face-to-face on FaceTime or 8x8 or Zoom where we see the patient and we get the vital information that we need to make a decision. It's not 100% effective, but it sure cuts down on a lot of the stuff that could be happening. So, we really make a concerted effort to make sure that when people are coming in, that they're okay. I mean, I have, almost 600 in staff I have to protect and all the patients that are there. So, I got to make sure that we have everything in place that's going to make sure and keep the safety of the people who are going to be there.
Well, as a CEO of a large company, you have mentioned more than once now about preparations regarding the safety not only of your clients, and patients, but also of your staff. Too often I see a lot of news stories about this rush to open up, which is business, which is understandable, but they seem to be thinking in terms only of, well, the customers, have to be made to feel safe. You got to start with your staff, don't you, no matter what business you're in?
Of course. I mean, first of all, if your staff is not well and sick, you're not in business. So they definitely need to be a priority when you're thinking about safety. And when you're thinking about safety of staff, I mean, it's inevitable that it's going to pass down to the safety of patients. So, our priority has always been, we need to keep everybody safe at all costs. So that's what we did. And we've been, knock wood, we've been very successful with it.
Well, as you mentioned at the beginning, this disease and this crisis has touched upon every aspect of life and business in the country in many ways similar across the board. But in certain cases, things are a bit different. And certainly in the behavioral health field, there are a couple of unique circumstances that impact what you do. I'm thinking in terms of the consequences of this thing. At the beginning, I said there may have been people who readily said, well, this isn't the time to try to get treatment. They need to be dissuaded of that. What are we hearing now about things like relapse rates, overdose rates? We're not hearing much about that. Is it getting worse or what?
Well, it's like this. We know what isolation does to people. It's not something that it's a new science. We've known that for forever. That isolation, especially with people who suffer from some form of mental health disorders, it's not good for them. Now, when you're talking about patients, they call us to come in. We're not seeking patients to come in. So when they call us, obviously there's a problem. We need to discuss it. We need to make sure that they feel comfortable in coming into a facility that's there to help them. We don't have statistics yet on what's going on in the last couple of months on overdoses and things like that, but you hear about them all the time. It's not something that's gone away. It's not something that's going to go away. So it's uncharted waters that we're all in. Mm-hmm. We don't really see any kind of outcomes yet. We are seeing a lot of positive outcomes in telemedicine because of retention and people being part of it and going to it. So that's a positive. People need to be engaged in treatment. So any positive way we can do that is a plus. And unfortunately, telemedicine is not approved by any insurance companies or licensed by the states yet because it's something so new in our field on our levels of service. There are telepsych and telemedicines for, one-on-ones and things like that, but we're actually doing groups. So we put that together in a matter of days. In a matter of days, we went from having an outpatient facility to opening a telemedicine facility that all of our patients that are there now will have somewhere to go and get treatment. Mm-hmm. And it wasn't an easy task, and technology was involved in that because we needed to figure out how we can reach people, how we can get to them, how they can be part of the group, and we did that relatively quickly and very successfully. And it's one of the things that I'm very proud of what we do is in our research department is track outcomes and track things that work and don't work. Now, not everything's a home run. So, we need to figure out what's best for people. How are people, when this is all over with, it's a new world. I mean, it's not February anymore. It became a new world. Yep. On how we do everything and how we live, not just my business, but all business. Yep. Everyone is afraid. You got a lot of people who are screaming about, the lockdowns and things like that, and everything should be open. And there, there's a lot to be said about that, and a lot of people have opinions. But, if you think rationally and you see, and look, I know people who have gotten this, and some people who have lost family members from it. I've had young relatives who've gotten it and came out of it well. I mean, but they said it was a horror. Mm-hmm. Unless you're affected by it personally, you don't think it exists or anything. I mean, obviously it is something.
Yeah.
And people got to realize it.
The other factor, I think, is, and it's perfectly understandable, is that everybody frames this in the context of, well, when will things be normal or the way they were? And you couldn't be more correct. That we've got to dissuade ourselves of the notion that there's any going back to the way things used. I mean, absent a miracle drug that eradicates this thing, and even then things are going to change. So we got to quit waiting for normal to return. I don't think that's going to happen anytime real soon.
No, and even what you said about having a miracle drug or vaccine, and I mean, if you know about flu vaccines, they're a low percentage of them are successful. I mean, they're still better than nothing because you're dealing from a strain that changes from year to year. But I think a positive side is teaching people about sanitary and being cleaner and being more conscious of our environment and things that we do. They've shown pictures of places in the world. This is not a United States problem. This is a world problem. That several months ago you couldn't even see a mile from where the picture is, and now it's totally clear. So the pollution and the environment in such a short period of time, because of this quarantining, has cleaned itself up quite a bit. Mm. I mean, it's still a long way to go.
Yeah.
But maybe we're learning from that. I mean, there was a shooting yesterday in a mall in Arizona. Said, oh, business is back to usual. We don't want that business back to usual.
No,
we want to be. Some of this is going to find some positive change, and that's what we need to do. I mean, we need to look at where the positives are. Everyone could look at negatives and find something negative in anything, but that's not going to help anything. Let's where are the positives? How do we make ourselves better? How do we help those who need help? And that's what we're going to be here to do. And that's all of us. That's not just in my industry. It's this whole world has changed drastically in the last couple of months. I don't know if it's brought us closer together yet. I mean, it's too early to tell what's going on, but there's a big change.
Well, you know what? Whether it ultimately becomes a beneficial catastrophe or good things come out of it or not is totally up to us. Peter Schorr, founder and CEO of Retreat Behavioral Health, is hanging with us on the Behavioral Corner.
At Retreat Behavioral Health, we believe in the power of connection and quality care. We offer comprehensive, holistic, and compassionate treatment from industry-leading experts. Call 855-802-6600 and begin your journey today.
Welcome back to the Behavioral Corner. This week is Peter Schorr. Peter's our partner, as I told you many times. The Retreat Behavioral Health, which he is the founder and CEO of, is the underwriter of the program. And Peter joins us from time to time, as do many of his managers and his clinicians and expert people when we need to get really good information. I assure you of that. The information we try to provide you is almost always the right stuff. That's our intent anyway. Peter, let's now peer into the crystal ball and try to figure out how something is important as our behavioral health and the choices we make and the kind of whole lives we want to lead is going to be impacted by the virus. We spent a lot of time in the first segment talking about the changes, and there are going to be a lot of them. But with regard to telemedicine, which, like everything else, we read stories about the end of the office. Nobody will be going into the office, and now we're talking about telemedicine. You don't have to go see your doctors as often and all of that. I wonder about some of that. I am struck, though, by something you said with regard to the insurance companies and why they are apparently not paying the same manner they would if you were getting counseling or treatment in person over the telephone or over the internet. Why is that?
Well, I can't speak for other people. I mean, let me just explain how this works. First of all, telemedicine in our industry, there is no licensing yet for our levels of service for outpatient. Like we do partial hospitalization, IOP. Telemedicine was set up for for one-on-one counseling. But now when this happened, and you have thousands and thousands of people that utilize outpatient services, that where they're going to go. So the state and the insurance companies, said, all right, we're going to allow you to do that now. But when this is over, it doesn't exist right now because there's no licensing for it. So what we've done is in our research department is start to track outcomes, to come up with some research on how this works and why it's important that it continues. So right now it's a lot of uncertainty when it comes to telemedicine. Telemedicine is, in my opinion, a very effective way to treat people who are in rural areas that can't normally go to a brick and mortar facility, people who have disabilities that are not mobile and they can't get to brick and mortar facilities. So there's a lot of positives from it.
Yeah.
But we have to, again, it's very early on in this that we need to track the outcomes and find out what's going on and what kind of successes we're having, and make sure that this is something that's sustainable and something that the insurance companies will get behind.
Yeah.
And the states have to get behind it. The states have to, come to some agreement and some kind of, they don't have it right now, is how do they license it?
Yeah.
How do they license it? You're not going to license someone because, you got to be careful about different states. So if I'm in Pennsylvania, I'm a licensed clinician in Pennsylvania. Is someone calling me from Kentucky and I'm giving them services and I can bill it? And that's not fair to the people who are licensed in Kentucky.
Right.
So they have to come up with some kind of formula on how they can make this, equitable and make it fair to everybody. It's not an easy task.
Yeah. So this is not the knee-jerk reaction of those miserable insurance companies. This is, I hear you saying that it's incumbent upon healthcare providers to prove that telemedicine is efficacious. It works. And that's going to take a little time. But it would seem to me the insurance company would be, delighted if you can prove that telemedicine has a legitimate and functional role going forward across a range of services. If that keeps people healthier, that's going to benefit to the insurance company anyway.
Of course. The insurance companies are looking for ways to get the cheapest treatment they possibly can and be most effective. Which it's a business,
yep.
and we understand that. And it's our job to give them statistics and show what works and what doesn't work. Because insurance companies, as far as I know, don't own facilities. They're insurance providers, and they pay us for a service. But how they gather their information and who they gather it with is anyone's guess.
Sure.
So it's something that we need to be in front of it and really get to them and get them what they need to make a intelligent decision.
Yeah.
Because in my opinion, I think it's something that has a definite purpose, and I think they have to just work out some of the semantics, and I think they will. I don't think it's that difficult. I think, it should be a state-by-state basis, but then I think you'll have a really important tool for people to get themselves well.
Yeah, it's like anything else. There have to be standards. They have to be measurable, and you have to see.
There's no ASAM criteria for telemedicine yet.
Yep.
There's nothing like that exists, so it's hard for them to have any kind of real information back yet until we give them all that.
So
that's what we're working on.
In that context, people should be advised that in spite of the fact that there's going to be a future for telemedicine, right now they should be very conscientious about believing some of the things you read. I mean, I read an article the other day about a whole slew of apps that are being developed that allege to be able to help you with things like, your substance abuse treatment, your mental health counseling. Yeah, we have to be careful about buying into that wholesale right away.
You don't want any snake oil salesman telling you that this is your answer. This is what's going to make everything okay. We had that years ago with pain medications, and look where it led us to. So we need to be careful on the things that we do, and have some research behind them, and not have someone in their basement come up with some concocted formula that says this is going to cure everything.
Right.
And just look at your app for 20 minutes a day, you'll be fine.
You'll be okay. Yeah. Let me ask you about your staff and with regard to the technology going forward and the change in how this behavioral health services are provided. What have you had to institute new training methods? Are they learning on the fly as well?
When we had our executive retreat first week in January, one of our goals for 2020 was to utilize technology in all aspects of what we do, not just on the phone, but a lot of different things we do. Come March, who knew that we'd have to utilize it and become experts in it in a matter of days? We had just signed on to this new phone system, 8x8, which is a lot like Zoom, but it's more proprietary, so it was a little easier. I've had 80 people on a meeting, and looking at everyone, talking to everyone, it's great. We all had to grow with it. We all had to learn how to use this technology because it's new. It's not something anyone's used before. The world has gotten more tech savvy, with all these Zoom things and this and that. It's and now what we're trying to use in technology is not only on that basis, but to have a patient stay to become as productive as we possibly can, to get them engaged as much as we can. So there's certain things that we're trying, and technology is definitely a plus for us in doing that. So, yeah, I mean, it kind of thrust us quicker than we thought we would be.
Mm-hmm.
But, I think that the staff did an amazing job understanding what the technology was, how do we utilize the technology, and what would be best for our patients.
Yeah.
They hit it out of the park.
And you're confident, as you've already said, that there is going to be a big and important role in telemedicine. Telemedicine going forward. The sort of unique circumstance of a substance abuse or behavioral health facility is that the one thing that really strengthens the effect of that is connection and community and people being together. And now, of course, we're told that you can't do that. So telemedicine can be a great bridge through the period of time when we have to be apart, but in a much more important sense, we have to be together. So telemedicine can really play a role right now in that.
And it does. I don't know if you've done it with your family. I know a lot of families. I did it with mine. Is like on holidays where we did a 25 people Zoom meeting, and it's there's nothing. When we talk about telemedicine, people think of it as just being on a telephone, and it's much more interactive than that. It's actually seeing people up on the screen, really being part of something.
Yeah.
So it's something that I think is going to be here to stay. I think it's something. Look, we're always looking for, and again, it's not just my industry. It's society in general is always looking to simplify and make things easier for us. And I think that not having to drive somewhere and to be able to do what you do is a plus.
Yes.
I mean, it's definitely a plus. I mean, there are going to be times though where, one of the issues is, especially on the outpatient side, you're on the honor system on whether you've been using or not. You can't do a urine test through a phone, but there's ways to work through that, and we've come up with some great ideas and how we can utilize local labs or something like that where people can go get tested and we can get the results right away.
Yeah.
There's a lot of ways we can do it.
I'm like you in that regard, and I certainly don't know what the future holds completely, but I'm really optimistic about some of this stuff. You've touched upon a lot of it because it just seems so obvious that failure is not an option. It is just not an option. So
no, failure is death in our industry.
Yes, right.
So it's not.
Right.
It's not an option.
There is
So
no option.
people can throw bricks in the road and try to throw things in the way of getting things done, and everyone can find a negative in anything. But there are a lot of positives, and we have to look at the positives in this and how we can give not just better treatment, but just to get the people and get treatment. Because, how many people fall through the wayside? If they're saying that 10% of our population in the United States suffers from some form of addiction, not necessarily substance abuse, but that's 30-something million people. Now, deduct that by 60%, that's still, almost 20 million people. Where are those people going? They're not going to treatment, that's for sure. We don't have that kind of bed capacity in this country, but they're not going anywhere because they don't understand where to go. So now if you make it easier for them to get treatment, we can save a lot more lives.
Yeah, absolutely. Absolutely. Peter, again, it's always great to have you on the program. We appreciate it. As we said, it's the Behavioral Corner. It's where we like to think healing can happen. We hang here and we talk about things. And I just wanted to, I know you saw this story, but I want to share it with you because it has to do with the way people behave. And just want to get people's insight on this and what they think. So you're driving down the road, as this Virginia family was a couple of days ago, just to get out of the house. They're going to go for a ride, and they see two bags in the road. They try to avoid hitting them. They run them over. They get out because who left these two bags in the road? Say, good people. They don't want to litter. They throw the bags in the back of the truck. They're going to throw them away when they get home, and they get home and find $1 million in cash in the bags. Okay? Now, the obvious question is, they called the police, by the way, instantaneously and said, we found this money. So the obvious question is, would you do that? I mean, would that be your first instinct to call the police?
That would be my first instinct. And again, I may be in a different economic situation than anyone.
Yeah, but you could still use $1 million, Peter. Come on.
But it's not the point. But the point is, there's a lot of things. That could be something that fell off a truck. That could be a lot of people's money. It could be something illegal, which could be even worse, and then you get caught in that. It could be a set. There's a lot of different things. Big Brother is watching. I always look at now, and someone's watching you,
right.
and you don't want to get caught doing something wrong. So, these are the things we teach people about consequences. And one of the things that we teach people is that all of your actions have consequences. And, good, bad, or indifferent, consequences are consequences. So if something, you think you have $1 million in cash, you think you're going to go, spend $1 million in cash somewhere? No, it's not. It doesn't work like that. I mean, let's be realistic. $1 million in cash is not something easily to hide.
Yeah.
There's a lot of things that you'd be dealing with, and one of them is guilt.
That's why I raise it as a kind of a thought experiment, because what we're going to explore here on this program is how our behavior affects our health and well-being. And unless you're a complete sociopath, if you fool around with that money in any way, shape, or form, it's not going to be good for you.
No, you're going to feel the guilt, remorse, and you're going to feel from that is not. You're not going to enjoy that $1 million.
Peter Schorr.
So hopefully you get a reward.
Yeah, it's a couple bucks anyway. Peter Schorr, founder, CEO, and our great partner with Retreat Behavioral Health. We thank you so much for your time, and of course, be safe. And we'll come back on the corner with us any old time, Peter.
All right, Steve. You take care. Keep safe. Everyone out there, just keep safe. Be smart on all your actions, and this has not gone away just because we're opening places. It's a new world how we live, and just stay safe and just watch what you're doing.
Yeah, we're in this for the long haul. Peter Schorr, thanks for joining us on Behavioral Corner. That's it for now. And make us a habit, hanging out at the Behavioral Corner. And when we're not hanging, follow us on Facebook, Instagram, and Twitter on the Behavioral Corner.